5, 4, 3, 2, 1. Hello, everybody. Happy Veterans Day. This is Christian Brindle, and welcome to another episode of the Everything Medicare Podcast, where, I try to every week. This term during the enrollment period, this time of the year is very difficult for us to do so, but every week I try to bring you a podcast where we talk about your Medicare, your Medicaid, your Social Security, and everything that has to do with your retirement. Today is November 11th, Veterans Day, so I wanted to start out the podcast by saying thank you to all the veterans out there who may be listening. If you've served our country, if you've been in the military, the Marines, if you've been a veteran of any kind, thank you. We appreciate you, and this is your day. So basically, folks, to honor Veterans Day, I wanted to talk about VA benefits and what their place is in the Medicare world and how they work with Medicare. Pretty much, it's one of those situations where it's very unique. I don't think anything quite works with Medicare like VA does, and there's different scenarios. Now, granted, the information I'm going to be talking about is somewhat current as far as how it operates in each state, but VA benefits is a little different state by state. So what I'm going to be talking about is my home state here in Utah, so it might be slightly different in your state depending on where you may be listening. Veterans benefits work something like this. For one, they basically have different kinds of VA benefits that you can get. So I'll start with the basics. Someone that has VA benefits, and let's say they don't have something like VA disability, and they're the primary veteran that is being cared for. Basically, folks, veterans benefits with Medicare does not work with Medicare. Typically, there are VA facilities, and you're able to go there, and that is where you get your care, and it doesn't cost you anything. But it wouldn't work typically at a private hospital or anything like that. However, there are some exceptions to that. Typically, if someone has an emergency room visit and they're hospitalized, the VA will pick that up and they'll come in and pay for that entire visit. However, they wouldn't pay for a planned procedure. That's the main difference. So sometimes with someone that has Medicare, they'll have that as a backup, if you will. Medicare will cover them at private institutions, private hospitals, but they will not pay at the VA facility, nor would they need to, because if someone goes to the VA facility, it doesn't cost them anything if they're a veteran. So, in short, in that situation, VA benefits will cover you at a VA facility, like the VA hospital or something like that. And Medicare will cover you at private hospitals. So they don't even pay for the same thing. So there's no need for them to coordinate benefits normally in that type of situation. The only really need to have Medicare if you have veterans benefits is if you want to go to a private hospital. You want to have the freedom to be able to do that if you so choose. Basically, it depends on where you are. It depends on a lot of different scenarios, but there's a kind of a reputation that the care that people get in the VA facilities aren't quite what they would be at a private hospital. The quality probably isn't quite there normally, and so that's a lot of reasons why people want the availability to go to the private hospitals. Stay with us into segment 2, where we will continue to talk about this topic and other different types of VA situations. Stay right there. Welcome back to the Everything Medicare Podcast, and this is our second segment of this episode, all about veterans benefits and how they do or don't work with Medicare. Again, today is Veterans Day. It's November 11th. We're dead set in the middle of the enrollment period for folks on Medicare, so I appreciate your patience as far as our lack of consistency bringing you these episodes. But so far, since the 1st of October and our busy time really started for us in our offices, we've been able to bring you one every couple of weeks. And so I'm intending to get back on track and have one for you each week, starting on starting this week, but bringing them to you each week on Sundays. And then once the enrollment period passes, we will try to bring them back on Mondays. So we're talking about veterans benefits. And in this first segment, I kind of talked about how it worked with regular VA benefits. Someone's not disabled, someone has Medicare, kind of how that works. Now, what about VA disability? Well, VA disability is a whole different animal. And now there's different percentages of VA disability, which make it incredibly complicated and make it really difficult for me to wrap up and explain all in one segment and one podcast here. But I'll just talk about 100% VA disability. 100% VA disability provides you coverage, full medical coverage in most instances, at private facilities. It's not just at the VA hospital. It's more like regular insurance, full medical insurance, fantastic medical insurance. Typically, they come with quite a bit of dental, vision, hearing aid coverage, all different kinds of stuff. Now, someone that has VA coverage is always going to get their medications covered at a very, very good price. But typically, you have to get them picked up at the VA hospital. But 100% VA disability will work very much differently than someone on regular VA benefits. There's also something called CHAMP VA that exists. You don't see it quite as much anymore, but typically when someone is 100% VA disabled, their spouse can get something called CHAMP VA, and that works as a Medicare supplement. It doesn't work necessarily the same as regular VA. So it would pay after Medicare. Medicare would pay 80% of their medical bills, and CHAMP VA would pay 20% of their medical bills if they were eligible for Medicare. So you see there's a lot of different scenarios with VA that can make it a little tricky and confusing. But unless you have VA disability, VA works the way I described in segment 1, whereas you basically get coverage if you go to a VA facility, no more, no less. Think of it like if you go to their facilities, you're going to get coverage, they're going to pay for it. But if you try to go to a regular hospital, it doesn't include their facility. So that's pretty simple when you think about it. It's not like TRICARE, it's not like federal plans or group plans or retiree plans or anything of those sort. It's kind of its own animal, and I thought it'd be very fitting if we spoke about it this week and today on Veterans Day, just in honor of the veterans and just to give them something to learn about how to get the most out of their benefits. Now, like I said at the beginning, every state's programs vary. So this might not be 100% accurate for each state, but in most areas, this is somewhat more or less what we're working with. Stay with me into segment 3 and we'll wrap this podcast up. Thank you for staying with us, folks, and thanks for making it all the way to the third and final segment. To close out, I just wanted to say I hope you folks are having a fantastic AEP, short for annual election period, where basically folks on Medicare, Advantage plans, and prescription drug plans are able to change their programs. You can go from a Medicare supplement to a Medicare Advantage plan and vice versa. We talked about it a whole lot since the annual enrollment period started and even a little bit prior to it. And I hope everyone's been listening to our episodes about this. If you haven't listened and this is your first episode listening to us, my name is Christian Brindle. I am a Medicare expert and specialist working in this industry for a number of years now. I grew up around it with my father doing it since the early 90s. And I started at an extremely young age, and I had him as a teacher to kind of teach me the ways and the ropes about Medicare in this industry. And we've worked with thousands of people over the years on their Medicare programs, and we're experts in that one field, and we try to bring you unbiased information and try to give you information straightforward because it's just not that easy to find out there. And I believe that's by design. The government is always trying to restrict people on what they're able to say, what they're able to explain, and we try to spell it out as frankly and as simply put as possible in layman's terms. One of these days we might get in trouble for the way we speak about the information, but we put it out there in a way that everybody can understand. We break it down into layman's terms, and we're doing a service, and we appreciate all your support on that. Again, I wanted to say thank you to all the veterans out there. Thank you for your service. If you've served our country, thank you for everything you do. We owe our freedom in the United States of America to you, and we do not take that for granted. You're the real heroes, and we owe you all a great debt and a great deal of respect for all your sacrifices that you've made for us and every other American. If you would like to work with us on your Medicare plan this enrollment period, if you'd like to see if you're on the best program, it's not too late. If you live in Utah, that's where we're located. But if you also live in Idaho and Florida, we also do business and work with folks in those two states. Those are the three states we work in at the very moment. We're always adding more states as time goes on, so don't be surprised if we start working and able to work with folks in your state coming soon. But for the moment, those are the three areas we work in. Call our office if you'd like to talk with us and get a free consultation about your plan. No cost, no obligation. And the worst thing that can come from it is that we discover that you're on the best program for you, and you can sleep better at night knowing that and not having any doubt in your mind. Our office number is 801-255-5340. Again, 801-255-5340 at Christian Brindle Insurance Services, part of Brindle Insurance Group. If you'd like to follow us on social media, you're welcome to do so. Our Facebook page is Christian Brindle Insurance Services. Our Instagram page is Christian Brindle Insurance. Our Twitter page is Christian Brindle without the E on the end because we couldn't fit all the characters. You can check out some of our educational YouTube videos just by searching Christian Brindle. You can also find us on LinkedIn at Christian Brindle. We try to keep up on the social mediums and bring you free information and content around the week. If you're not in one of those three states I mentioned and you'd like some guidance on your Medicare plan, the best thing I can tell you is I published 2 books on Medicare plans to help guide people because I'm not going to be able to work with everybody directly. There's just only one of me and so many of you. So the best thing I can tell you is the first book I wrote basically breaks down the basics of Medicare. It's called Medicare Guidance, Picking the Plan for You. It's a little red book. It's about 50 to 60 pages long. It's an easy read. You can probably polish it off in a day. It's $5.50 on Amazon right now. It's the lowest price I can possibly have it at. For that price, we are practically giving it away because there's a chapter on everything you need to know about Medicare to make the proper choice. There's a chapter about original Medicare A and B. There's a chapter on Medigap's Medicare supplements. There's a chapter on Medicare Advantage plans, and there's a chapter on prescription drug plans. If you can finish that book, if you can get through it, if you can stomach it, because granted, I try to make it as interesting as I possibly can. That's kind of what I do. But at the end of the day, it's still Medicare. It's not the most fascinating topic to read about. So, if you can get through it, you'll know more about Medicare than probably 95% of all your friends, families, neighbors, whoever. People that you have acquaintances with. You'll know more about Medicare, probably more than 95% of the people in your everyday life. So that's my best recommendation. For the price we charge for it, we're practically giving it away, because it's got so much good information. I break it down in a simple, easy way that it can be understood. A child could read it and understand Medicare, I believe. And so that's my recommendation. If you haven't already, head over to Amazon, look for my name, Christian Brindle, and also Medicare Guidance, Picking the Plan for You. And I appreciate you folks listening. I can't wait to talk to you next week. I hope you have a fantastic Veterans Day, or what's left of it, because we're coming to bring this to you kind of later in the day. And again, to all you vets out there, thank you for your service, folks. Thanks for listening. I appreciate your support greatly, and we will see you next Sunday. Have a great, great week.